Gabrielle DiBenedetto, and I'm a clinician here at BHBA who specializes in the treatment of anxiety disorders and obsessive compulsive disorder, or OCD. Today I'm going to be talking about the gold standard treatment for OCD, exposure and response prevention, or ERP. What is ERP? ERP stands for exposure and response prevention. Sometimes you may see it written as EXRP, it's the same intervention. As indicated by the name, there are two components of ERP: exposure and response or ritual prevention. The first component, exposure, is the practice of facing thoughts, images, objects, or situations that provoke your obsessions and trigger intense feelings of uncertainty or anxiety. The second component, response prevention, involves resisting urges to engage in compulsive behaviors in response to your obsession. For example, if you have obsessions about contamination, resulting in a compulsion of excessive hand washing, you and your therapist would expose you to a contaminant and have you resist washing your hands. But why would we do this? Why would we expose ourselves to the very thing causing our anxiety? ERP is based on a concept called the threat aversion model. This model shows us the loop that OCD can get you stuck in. When you experience an obsession or worry thought that triggers an increase in anxiety, there is then a sense of urgency to do something to neutralize that anxiety, and so you perform a compulsion. This provides a sense of relief because your anxiety has gone down after performing the ritual. However, this relief is only temporary. The next time you encounter the obsession, your anxiety will rise again. By continuing to engage in this loop, your brain learns that the only way to relieve anxiety is to perform a compulsion. ERP helps you break that cycle and allows your brain to learn something new. By practicing tolerating anxiety without performing compulsions, you learn that feared outcomes are unlikely to happen and that anxiety and uncertainty are manageable emotions. ERP helps you control OCD instead of OCD controlling you. What happens in ERP treatment? What will you and your therapist be doing together? We start by using the Yale-Brown Obsessive Compulsive Scale, or YBOX, to collect information about a client's OCD symptoms and history. This includes information about their obsessions, including intrusive thoughts and fears about what will happen if they don't perform their compulsions, and the rituals, or things they avoid in order to decrease anxiety around their obsessions. The YBOX also assesses the severity of OCD symptoms, based on time spent obsessing and ritualizing, the degree of control one has over these behaviors, and the amount of distress these symptoms cause. Your therapist will provide the rationale for treatment, which is based on the threat aversion model. First, exposure challenges the belief that anxiety will last forever. Research shows that intense anxiety will decrease on its own after about 15 minutes. ERP helps clients learn to tolerate that anxiety and see it naturally decrease without compulsions. By practicing exposures over and over again, clients eventually see themselves habituating, or getting used to, confronting a fear without ritualizing. Second, by exposing to the anxiety-inducing trigger and inhibiting compulsions, clients gather evidence that the outcome they are trying to prevent through ritualizing is unlikely to happen. At the same time, ERP helps clients learn to tolerate uncertainty. Our feared outcomes are always possible, but we can't spend all our time trying to prevent them. Lastly, many people with OCD utilize avoidance, or pushing away of thoughts associated with obsessions, or using compulsions to neutralize those thoughts. ERP helps clients learn that intrusive thoughts are just glitches in the brain and don't actually hold any real meaning. After providing rationale, your therapist will also help you connect to your motivation for overcoming OCD, even when it's hard. In the next stage of treatment, you will work with your therapist to make an exposure hierarchy, which consists of all the situations and thoughts that invoke anxiety or the urge to ritualize. You will then assign an anxiety level to each situation. How anxious would it make you, on a scale from 0 to 100, to confront this situation or thought without performing a compulsion? You will then put the exposures in order from lowest to highest according to its anxiety rating. This hierarchical approach ensures that clients feel a sense of mastery over lower level exposures before moving on to more challenging ones. There are two types of exposures that you and your therapist will engage in during treatment. The first is called an in vivo exposure, or an exposure that you will do in real life. In the example I gave in the beginning of the presentation, touching a contaminated surface without washing your hands is a real-life exposure that can be done in session with your therapist. You will repeat this exposure over and over again until it feels like something you can do easily. However, some exposures cannot be realistically or ethically performed in a therapy session. This is when we will use something called imaginal exposure. In an imaginal exposure, you will write a script describing the feared outcome and read it with your therapist in session. For example, if you have a fear that your dog will run away if you do not perform a ritual, you and your therapist would write a script about your dog running away. Just like with in vivo exposures, you will repeatedly imagine that outcome until your anxiety decreases. You will complete the exposures according to your hierarchy in session with your therapist, and then practice those same exposures throughout the week for homework. The success of ERP is dependent on repetition and consistency, which is why continuing to practice exposure outside of your weekly sessions is so important. If you are a parent or loved one of someone with OCD, you may be thinking, how can I help? Family is actually an integral part of ERP treatment. Parent accommodation training is an essential part of treating OCD in children and teens. Your child's therapist will provide psychoeducation about OCD and the rationale for treatment, just as they did for your child. We help parents identify how they may be unintentionally maintaining the loop of OCD. This is called accommodating the OCD by doing things such as allowing your child to avoid feared situations, providing reassurance, and doing things for your child. Your child's therapist will help you identify ways to support your child's treatment without accommodating. One of these ways is to reinforce exposure practice at home and encourage your child to show their capability. The therapist will also ask you to drastically reduce or eliminate providing reassurance to your child, and will help you work on supportive statements to make instead. We highly recommend the book Freeing Your Child from Obsessive Compulsive Disorder by Tamar Chansky as a resource for learning even more about OCD and how to support your child. Why do we do ERP treatment? Because it works. ERP is the most effective treatment for OCD. Research shows that 65 to 80% of children, adolescents, and adults see a decrease in their OCD symptoms within 6 to 18 weeks of ERP treatment. ERP makes OCD symptoms significantly more manageable, and in some people, symptoms disappear altogether. I hope this presentation provided some helpful information about OCD treatment and recovery. With the help of ERP therapy, OCD is treatable and beatable. Thanks for watching.